My name's Shayna Casper. I'm T1 International's executive director. I've been living with with type 1 diabetes for 12 and a half years now, and have been a part of the diabetes community for 5 years before that, when my little sister was diagnosed. So I live in Vermont in the northeast corner of the US, and I got involved with T1 International because having rationed insulin, I knew I needed to find diabetes community, but I didn't know where there was that diabetes community for me. So much of the community that I saw was funded by big pharma, and despite insulin being discovered over a century ago, only 3 insulin manufacturers control 90% of the market, meaning that they control access to what we have as patients, to this life-sustaining medication. And I wanted to fight against this abusive system and find real meaningful structural solutions to the insulin access and affordability crisis. And so after 10 years as an organizer in the environmental health world, I joined T1 International in policy work about 3.5 years ago. So who is T1 International? We want to keep going ahead in the slides. I think we might be a little bit, I don't know what is going on with the order of the slides here, sorry. But let me just get started with sharing some about T1 International's vision, mission, and values. Our vision is that we believe in a world where everyone with type 1 diabetes, no matter where they live, has access to everything that they need to survive and achieve their dreams. Does that resonate with folks? See some thumbs up? Awesome. I'm actually just going to pause for 1 second to see if we can get our slides back up here as well. Or like loving seeing all these thumbs up. Nice. And so our mission is that we support local communities by giving them the tools that they need to stand up for their rights so that access to insulin and diabetes supplies becomes a reality for all. And here are some of our values. We strive to be patient-led, inclusive, independent, bold, transparent, and hopeful. So let's just take a moment with these values and just put in the chat, what is one value that is really resonating with you today? Let us know why in the chat here. What value is really resonating with you? Being bold, being independent, free of pharma funding, being inclusive. Lots of votes for patient-led, being independent, being bold. Sorry, I'm getting some of these out of order, I think. Nice. Thanks so much for coming on. So let's keep going along here. But yeah, patient-led, inclusive, loving these values. Seeing some strong arms here. So what do we do at T1 International? I'm going to start with a little bit of information about our advocacy campaigns, our actions, and how we work before handing it over to Janice to share more about why rapid-acting insulins are important, and then over to Chris to dive into our work on rapid-acting insulins, adding to the essential medicines list. So our advocacy campaigns, so based on our policy analysis, in order to achieve this vision, we need to win these policy goals. We think that no one should be spending any more than 5% of their income on insulin and testing supplies. Access to affordable insulin includes World Health Organization action, country-level enforcement, including a price cap on insulin, and mandating that pharmacies provide insulin to those in urgent or emergency needs. We also are working to challenge Big Pharma's monopoly power by advocating for transparent drug pricing, patent reforms, robust competition, including public pharma that enhances drug affordability and access globally. And we also think that everyone deserves quality and equitable healthcare. So this includes, for some of our work, expanding pharmacist scope of practice, which we call Kevin's Law in the US, and enhancing timely access to insulin and other essential diabetes medications and supplies worldwide, as is written out there. So we believe that in order to win these policy goals, we need to take action. So we run targeted and strategic advocacy campaigns that mobilize a diverse community and various groups for strategic and grassroots actions at various scales. So I'm seeing here some folks who are advocates in countries all across the globe. And I'm also seeing some partners. So we also work to build strong and supporting connections and collaborations with a wide range of partners to support T1 International's vision and to support our community-led research as well. So I'm seeing here Kelia Moses from We Care Sierra Leone. I'm seeing Pilar here from Diabetes Latam in Panama. Yeah, seeing folks from tons of different groups that we work with. Nina's from Santi Diabet in Mali, and Burkina Faso, and Comoros. So lots of different partners are really vital to our work. We empower strong local groups to achieve campaigns and policy objectives tailored to their own specific local contexts by building supportive communities and networks for those most impacted by unaffordable or inaccessible insulin. So we work to foster strong leadership skills through authentic relationship building, and our commitment to sustainability and inclusion is really underpinned by having a really diverse and dynamic team and support. So I'm seeing here, we've got some chapter leaders as well. We saw Dawson, our chapter leader in Utah in the United States. I think I saw Mark on here, a chapter leader in Nigeria. Shout out to so many folks here with us. And then, yeah, we also work to promote leadership among those most impacted by the insulin price and accessibility crisis to drive our work for insulin for all at all levels, in goal setting, in campaign planning, in our organization's team and leadership and stories and our communications, in the media, across all sectors as we're talking about, really grounded in our ethical patient engagement principles. So we do this through a bunch of different ways that I've just been talking about. We've got our chapters, we've got Insulin for All chapters across the globe, we've got partners that we work with all across the globe, and then we've got individual independent patient advocates all across the globe. And we have leadership from these different spaces. We have our Fight for 5 working group, our federal working group. Families United for Affordable Insulin is made up of people who have lost loved ones from rationing insulin due to cost. And then we're running these advocacy network mobilizations, which we'll be hearing more about how to get involved in that at the end of this call. And then we're also running our Speakers Bureau right now to bring new advocates into our movement. So that's it for me. I'm going to hand it now over to Janice, and then we'll hand it over to Chris to share more about what we're here on today for our essential medicines list. So Janice will be sharing about why insulin access is important in her South Africa situation. So take it away, Janice. And Janice, I think oh, there we go. Great. Too many. Got to unmute you again.
There we go. Thank you, Shayna. My name is Janice, and I am a T1 International #Insulin for All advocate in South Africa. I believe in a world where everyone who needs insulin, no matter where they live, has access to it. Access to insulin is important to me because I live with type 1 diabetes, and we are far from reaching and achieving this goal. 1 in 4 people with diabetes have been forced to ration their insulin due to cost, leading to significant health impact. Insulin is the mainstay of therapy to treat type 1 diabetes and a common treatment for type 2 diabetes as well. All over the world, people cannot afford this life-sustaining medication, and I have been one of those people. In South Africa, the production of insulin pens was discontinued by Novo Nordisk. This left the government and medical professionals reeling, and more importantly, patients trying to manage without insulin pens. Chaos ensued to find alternatives, and to date, patients have had to return to using vials and syringes, which has left the most vulnerable at risk of over and underdosing. A lack of syringes has also left thousands with injuries from stabbing themselves with blunt needles. As a person living with type 1 diabetes for 43 years, I cannot stress the importance of being able to access insulin enough. Insulin has been a part of my existence almost in its entirety. My life literally depends on being able to access insulin. Without it, I will die. After I was diagnosed, I only had access to animal insulin, but my body rejected it. So I spent most of my youth and childhood in hospitals dealing with diabetic ketoacidosis. From the age of 16 to age 17, I had no choice but to rely on animal insulin as it was the only treatment option in South Africa. Not having access to the correct treatment for my body had severe effects on my health. As a type 1 diabetic, I have to inject myself with insulin daily. But when my supply of insulin becomes inaccessible and unaffordable, the consequences are dire. In my lifetime, I have been forced to ration insulin due to inefficient healthcare systems, unaffordability, supply constraints, and other socio-economic and political factors. If and when I could access it was never guaranteed. So I had to ration my insulin. I would start feeling odd. My blood glucose levels escalated. I stopped eating. I vomited. I developed diarrhea, but I was incapable of getting up. So I had to lie in my own mess. I drank gallons of water. Well, that is for me who actually had access to water. My mouth remained dry. It smelled like glucose. My eyesight faded. Any type of light would sting my flesh. I became more sluggish. My chest would rise and fall with small breathing. I was literally running out of insulin, and I was waiting to die. I am part of a select few who were lucky because I somehow managed to survive this ordeal. When different options of insulin finally became available to me, my whole life changed. I felt slightly normal for the first time. Initially, I was skeptical and kept wondering when I would end up back in hospital. But it was only after a year on new insulin that I realized that this change was for real. In low and middle income countries, we barely have a choice. We just have to accept the only and often the cheapest option. For me, the ability to choose gave me some freedom and time to live my life. Choice is extremely important for me, person living with chronic conditions, and having the option of rapid acting insulin analogs allows me to experience a life outside the hospital. So right now, we have an urgent solution, and that is adding rapid acting analog insulin to the World Health Organization's essential medicines list. Why? Because rationing insulin ranks as one of the most dangerous measures that a type 1 diabetic can undertake to survive. And yet, millions of us have done this, and billions continue to do this. Easing the burden of a chronic condition by using mechanisms like rapid acting insulin to mimic the body's normal function. Decreasing the number of people who are forced to ration insulin. And by doing that, decreasing the number of deaths related to insulin rationing. So right now, we are asking you to join us. And we need each and every person here to add their voice to the appeal, to add rapid acting insulin to the essential medicines list. Remember, access to insulin is a right, not a privilege. And we need to ensure that all insulin is accessible to all who need it. And by doing all of these things, we also need to raise our voices to end the need for greed. Thank you so much. And I think I'm passing on to Chris now.
Yeah, Janice, thank you so much for your story. I'm empowered every time I get to meet with Janice, and I'm very thankful that she was willing to speak to you all today. So, hi everyone. My name is Chris Taves, and I'm the Global Advocacy Manager for T1 International. I'm going to be taking you through the whys behind our application, more details about what the Essential Medicine List is, and other ways that you can get involved. So just a little bit about me. I've had type 1 diabetes for nearly 12 years and really dove right into research, writing, educating, and advocacy after a very traumatic diagnosis in my early teens. And my initial focus through all that was on the United States insulin price crisis, but that's scope quickly grew to an international level when I discovered that access is very much a global issue. And so my commitment is to this community in changing policies that highly improve the lives of all those who rely on insulin to live. And I immediately jumped on this project upon starting with T1 International because I believe it's imperative that all types of insulin are recognized as essential. And so just a quick poll, if you're taking rapid-acting insulin analogs, go ahead, put that in the chat, tell us which one if you would like. And also just a little reminder that we will have a short Q&A at the end of this presentation, but we're going to be answering questions from the chat. So if you have any questions, you can write them down and I would save them to put them in the chat near the end. So as type 1 diabetics, we know that rapid-acting insulin analogs are life-changing. Everyone just heard that in Janice's really powerful story. And as a T1 International community, we wanted to make sure that these insulins are available and accessible to everyone. But nobody else was working on this access point. So we ourselves at T1 International wrote and submitted the application. And I just want to shout out to Liz, who's on this call, and Luis and Marlene, who sadly couldn't join today, but all of them supported me and helped me to write this application and submit it. And it's really just amazing to see that we have within our community the expertise and skills to do something so huge. So talking a bit about the benefits of rapid-acting insulin analogs, so they allow for improved glycemic control and flexibility in administration timing. So patients really benefit from reduced severe hypoglycemic episodes and can facilitate better daily management of their diabetes. So we know these insulins have better outcomes for patients, and we believe that all patients deserve access to those better outcomes. And just spotlighting patient choice and preference, right? Patients with diabetes increasingly prefer rapid-acting insulin analogs for the flexibility and control over their blood sugar levels. And so by advocating for their inclusion in the essential medicine list, we help ensure that patients can choose the insulin that works best for their individual health needs. Our mission is to achieve access to insulin for all, and this project is a huge step toward that goal. And when we say preference, we're not saying it's preferring to treat a low blood sugar with honey versus juice, but rather preference is rooted in greater blood sugar control and vastly improved quality of life that many, many patients experience when switching to analogs. So going further into what is the essential medicine list? So the World Health Organization put out this list as a register for minimum medicine needs for every healthcare system. The aim is that the use of a limited number of well-known and cost-effective medicines can lead to improved long-term medicine supply, lower costs, and better healthcare provisions within countries. And the list helps define which medicines are essential for health systems worldwide and can help aid decision makers in ensuring that necessary medications are accessible to populations. It's not meant to replace individual national essential medicines lists, but rather to be used as a guide to help inform the purchasing decisions in different contexts for national health agendas. So the basic concept is that these high priority drugs should be available as a part of a functioning health system at all times for all people. And this really leads into the importance of universal health coverage, right? So access to essential medicines is fundamental for achieving universal health coverage. There is no universal health coverage without accessing these medicines. So by guiding governments and health facilities on different cost-effective interventions, the essential medicine list helps facilitate health equity and enhances health system sustainability. And so, as I mentioned before, it's a guide for countries, so not every country has to follow it, but over 130 countries do utilize the essential medicine list to help shape their individual medicine lists and purchasing decisions. And this widespread adoption really reflects the global commitment to improving health outcomes and quality of care across diverse health systems. So it just proves that this list really matters. Countries look to that and they influence the real medicines that real patients like Janice, myself, and many of you have access to in countries. So now we're going to dive more into this lengthy process that we have embarked on. And so the first essential medicines list was published in 1977 and is updated every 2 years by an expert committee that reviews the list and makes those changes to it. So this committee of experts is formed from people around the world that represent fields like medicine, pharmacology, policy, regulation, and health organizations to help incorporate the new evidence and recommendations. And this process really ensures that the list can remain current and relevant to health systems and populations across countries. So we're really emphasizing this because we cannot wait 2 more years for a medicine that has been available and life-changing for decades. Patients need these medicines now, and that's why we've worked so hard to get this application submitted and why we're following through to make sure that rapid-acting insulin analogs get added to this highly influential list. So if you know that you have rapid-acting analogs available in your country, go ahead, put that in the chat, yes or no, just to see. So the evaluation then for adding medicines to this list is based in a rigorous evidence-based assessment of effectiveness, safety, and practicality. So it considers factors like disease burden, resource allocation, and feasibility of implementation in various health contexts. And so applications for including or having changes or deletions to the list can be prepared by outside institutions like T1 International, but they have to be evidence-based and explain why specific drugs meet the criteria for acceptance. And what we found is there's a lot of evidence across different factors to support the inclusion of rapid-acting insulin analogs to this list. And this is just a closer look at the timeline. So applications are open from May to November, and then it is communicated to applicants whether or not they're moved on to the next stage in January and February of the following year. And then there's a period of time where the public can submit comments. The expert committee meets in May, and then the results are published in July. So we've already done a major lift by getting the application written and submitted before last November in 2024. And now we've got our eyes on this super important meeting in May when public comments from people like you and me and everyone on this webinar become essential to the process. And that's really why we're holding this webinar and other working groups to support this advocacy and making sure that rapid-acting insulin analogs are added to the list. And we're gonna now talk about why they're not already on the list, because I think I've talked a lot about the benefits, but you might be wondering, Chris, why aren't they already there? And unfortunately, it's due to a lot of concerns from the medical and academic community. And so despite the advantages, this exclusion limits access and affordability for patients, particularly in low and middle income countries. And we saw that long-acting insulins, it took 2 different rejections before they were finally added and accepted in 2021, and then officially on the essential medicines list in 2023. And a lot of people in this community helped get long-acting analogs added to the list. So if that's you, go ahead, put that in the chat, and just really want to shout out and highlight your help in making this a reality. And so this is just a close-up of the most recent essential medicines list. The first 2 insulins are human insulins, And then you can see long-acting as the next one. So hopefully we'll be able to see rapid-acting soon. So as I mentioned, there's a lot of concerns from the medical and academic community that have prevented even just a simple application to try and get rapid-acting analogs added. And the concern is really that by adding these insulins, it could lead to higher list prices, or that the clinical benefit of rapid-acting analogs is not great enough to justify the higher cost of production. And so many argue that this could discourage the use of other affordable forms of insulin, like human insulin, mixed insulin, which could overall lead to more access issues. However, the expert committee claimed in 2021, when they approved long-acting analogs, that this is an effort to make insulin more affordable by promoting more insulin alternatives. And if we look at the historical outcomes of when medicines are added to the essential medicines list, we see a tendency for price reductions. So we saw this with long-acting analogs, with some hepatitis C antivirals, and some other cancer treatments. And so the example of long-acting analogs shows that this lengthy process of adding those insulins to the list created a significant shift, not only in diabetes management, but influencing global access and pricing strategies. So within about 2 years of adding long-acting analogs to the essential medicines list, we saw price reductions. So we know that from previous additions, getting added to this list likely leads to price reductions and not increases. And just a quick look at cost of production insights. So the production cost of rapid-acting insulin analogs is only marginally higher than that of traditional human insulin. So you see here, it's about $2.30 to $3.42 for human insulins, and then about $1 to $3 more for analog insulin. And really, like, an informed understanding of these costs helps in advocating for policies to help make these medications more accessible and affordable. And we also see in recent studies that the long-term cost benefits of rapid-acting insulin analogs and the improved clinical outcomes do justify their addition. So the issue then ultimately lies in the list prices being set by pharmacies, pharmaceutical benefit managers, and the pharma companies themselves, and not with the potential inclusion on the essential medicines list. So that was a lot of information, and I'm sure you have many questions. We'll get to those just in a moment, but just wanted to highlight some additional opportunities that you can get involved. So this webinar is to give a pretty big overview of our why behind our application, different reasonings of why these analogs are not already on the list, and just explain more about how this, can really move our mission and goals in the right direction. And so we're also going to be holding a mobilization group where it'll be 3 sessions to focus on a deeper dive into the essential medicines list, how to storytell with facts, and then practicing sharing your story in both in-person and digitally to help with that open session on May 9th. And by participating in this training, you can help ensure that these rapid-acting insulin analogs receive the attention they deserve in the global health settings and discussions. And so the application deadline is March 23rd. It's a Sunday, because the first session starts April 2nd. And so we're going to drop that link in the chat here if that sounds interesting to you to sign up for. And if 3 sessions is a bit too much time commitment, or you don't have the ability to join, there's definitely other ways you can get involved. So if you are a technical expert joining this webinar, we're really grateful that you're here, and we'll be following up with you to go ahead and submit a comment to the WHO. And we really thank you for your support on our application. Another way you can get involved is to share your personal experience with us to really amplify your voice and patients' voice. So we're going to be showcasing several advocate stories in our Essential Medicine List emails, our social media posts, leading up to that open session on May 9th. And so we're also going to drop a link in the chat for that. And lastly, you can sign our petition. This is probably the easiest way to get involved, so I really encourage everyone to do so. We're going to be delivering this petition to the World Health Organization on April 18th, right before the comments close on the application. And every signature really counts. So we would love for you to sign that petition and help us signal to the World Health Organization that it's imperative that rapid-acting insulin analogs are added to the essential medicines list. So we're also going to drop that link in the chat. So lots of links, be sure to click through them. And now I'm going to hand it over to Lib to talk about a couple more opportunities.
Hey, everybody. I'm Lib, T1 International's US Advocacy Manager, and I support all of our US-based chapters and also run trainings for our whole network. So if you're inspired by the work here with the Essential Medicines List and you want to feel really confident and clear about how to share a powerful story in support of a campaign like this, you are very warmly invited to join our New Advocate Speakers Bureau. So this is a 3-call training series where we dive into what makes an impactful advocacy story and practice together writing and speaking the reasons why we fight for insulin for all. So Allison will drop that link in the chat. Our next session is of the training is gonna start this spring. Shout out to anybody on the call who's in our current New Advocate Speakers training that's running right now. And please feel free to be in touch if you're interested in joining that training. And I'm going to turn it over to Shayna.
And I'm going to pause for just a second here because there's a bunch of links shared in the chat there. So do folks want to click on those links, sign the petition, sign up to join the mobilization working group over the next couple of weeks, sign up to join our New Advocate Speakers Bureau? Let's just take 1 minute to have everyone make sure, at the very least, sign that petition. Let's get a whole bunch of new signatures in right now. So I'm going to ask you to make a donation. If you're not able to join our mobilization, or even if you are, there's other ways to support T1 International and our work. And one of those ways is to donate. At T1 International, we have really firm and strong values. We are independent. We don't take any donations from the pharmaceutical industry or from anyone who could compromise our independence. We're here to empower people to create real, meaningful, lasting change in the insulin access and affordability space. And so by donating to T1 International, you're helping us continue to make this change and changing the reality of people living with diabetes, like me, like many of the folks you've heard from today, and across all these different participants on this call, all around the globe. We have a goal of raising $10,000 by April 5th. We'd love to have you help us reach that goal. Can you give $10, $100, $1,000? We're going to put the link in the chat right now, or you can click and donate as well. And if you can't give right now, totally understand. There's so many other different ways to get involved by all these different activities that we've been talking about. And we can also have you fundraise. We're running lots of different fundraisers, whether that's holding a movie night, having a group gathering at your home, doing something fun like running a race or having an event where you're fundraising for T1 International. So we'll drop that link in the chat as well if you're interested in fundraising for T1 International.